Welcome back everyone, this is the Oral Cancer Prevention Project and this is your host Nhi. On the previous episode, we talked about the signs, the symptoms of oral cancer as well as the importance of early diagnosis. So if you missed that episode, you can always find it on our YouTube channel, the Oral Cancer Prevention Project. With no further ado, let's jump right onto today's episode, which is about diagnosis and treatment options. So let's start off with a hypothetical situation. After you experience those symptoms, you decided to go to the dentist. And here's what's going to happen to you. You're going to go through multiple tests and procedures to diagnose whether you have oral cancer or not. The first one is physical exam. After you've told the dentist about the symptoms that you've been experiencing, the dentist will take a look at your mouth and specifically the area that you may found irritating. They will examine and try to look for any abnormalities such as white or red patches. Now if they have found a suspicious area, the dentist will use a cutting tool or a needle to extract a sample of your tissue. Then they'll send that sample into the laboratory for testing. This procedure is called biopsy. In the laboratory, the sample of cells will be examined or analyzed for any cancer or precancerous changes, indicating the risk of future cancer. After examination to determine whether or not you have cancer, if you have cancer, your dentist will continue to diagnose what stage is your cancer at. You will have to go through a procedure called endoscopy. The procedure is a simple test to inspect your inside body. And what I mean by that is they will use a thin, flexible tube with a small camera and a light on it. The tube will be passed through your throat. This way the doctor can observe and look for any signs of the cancer, to see if they have spread beyond your mouth. Next is imaging test. Imaging tests may include X-ray, CT, MRI, or PET scans and others. They have the same purpose to help determine whether the cancer has spread beyond the mouth area. However, not everyone needs every test, so your doctor will advise you which tests are suitable for you based on your condition. Moving on to the choices of treatments, there are a lot of treatments for oral cancer. And as I said before, the sooner the cancer is detected, the more effective the treatments will be. There are options for your treatments like surgery, radiation, and chemotherapy. This is when you should discuss with your doctors, who can advise you to choose based on your cancer location, stage, and also your overall health and personal preferences. A very popular option is surgery. The oral cancer surgeries include: the first one is a surgery to remove the tumor. This is when the tumor and the margin of a healthy tissue is removed to ensure all the cancer cells have been removed. Smaller tumors can be removed by minor surgery, while the largest one require a more extensive surgery. If the cancer cells have spread into the lymph node in your neck, or there's a high risk that this has happened, judging by the size and the depth of your cancer, your surgeon will recommend a procedure to remove the lymph node and other related tissues in your neck. Lastly is to reconstruct your mouth. Your surgeon will transplant graft of skins, muscles, or bones from the other parts of your body to reconstruct your mouth. This procedure will help you rebuild your mouth in order to talk and eat again. Keep in mind that surgery carries the risk of bleeding and infection, especially for mouth surgery. It can also affect your appearance and also your ability to eat and speak. You will need a tube inserted through your nose and to your stomach to help you consume food and drinks. Another option for you is radiation therapy, which uses high energy beams, for example X-ray and protons, to kill cancer cells. The treatment is often used after surgery, but it can be used alone if your cancer is still in an early stage. Moreover, radiation therapy can be combined with chemotherapy. However, the side effects will be increased too. Nevertheless, radiation therapy can help you to relieve the symptoms that's caused by the cancer, such as pain in cases of advanced oral cancer. It is advised that you visit your dentist before radiation therapy to ensure that your teeth are as healthy as possible. If any teeth are unhealthy, will require treatment or removal. The side effects for radiation therapy includes dry mouth, damage to your jawbone, or even tooth decay. So it is best if you're informed on how to take care of your teeth during and after radiation therapy. Lastly is chemotherapy. In this treatment, chemicals will be used to kill cancer cells. Chemotherapy drugs can be used alone or in combination with other cancer treatments. For example, radiation therapy will be more effective if it is combined with chemotherapy. The common side effects of chemotherapy are nausea, vomiting, and hair loss. And that is the standard treatments for oral cancer. There are also treatments like targeted drug therapy, immunotherapy, but it is only used when the cancer is not responding to the standard treatments. Now we have covered the diagnosis and treatments for oral cancer. That is it for today's episode. Thank you all for tagging along. I truly hope these information that are useful for you. Don't forget to hit subscribe to our channel and follow us on social medias for more episodes like this one. Goodbye and have a good day.